A lot of questions that come up for moms is, how often should I feed and how long should these feeds last? That can look very different for each person. They're going to demand the milk when they're wanting the milk. Ideally, we're going to want to make sure we're feeding our baby every 2 to 3 hours. That's kind of roughly our guideline. But we don't want to tell that to mothers so they don't think their baby should eat until that 3-hour mark, because the baby is actually going to set up the stage for how often they're going to feed. And we really do try to educate women on these mothers that are in the hospital with their newborns that the cluster feeding is normal, and that is just baby's way of increasing that demand. And the more demand the baby is requesting, the more the mother's hormones are going to respond, and that supply is going to increase. So that is going to be the best way for the mother to bring her milk in. In those first few days, we don't really, that baby's just getting that colostrum. That colostrum is wonderful thing for the baby to get. And so those early days, it is going to be so important to just get baby to breast as much as they're interested in breastfeeding. And each feed could look a little different. One feed might be for 10 minutes, and the baby isn't interested in nursing on both sides. The next feed, the baby might want to nurse for 45 minutes or something, and that's all very normal.
That's 100% true. It does look different for each mother-baby dyad is what we call them, their journey together. But as she touched on, it is so important just to be following the baby cues, and it's very baby-led feeding. But there are times where we have sleepy baby. So especially like in the first 24 hours, the baby is very sleepy and doesn't want to wake up. And so doing skin to skin can be, it's our great reset, basically. It's
skin
our
to skin. That's always what
it's always the
about.
answer.
Very important.
So if you're not sure what to do, skin to skin is a great starting point to get baby up on your chest and close by. That helps get your hormones going. So all of breastfeeding is very hormone driven. And so if we can jumpstart those hormones and get that bonding and connection going, that can help improve a lot of the scenario.